Well, Alberta has just recorded its first severe vaping-related lung illness. It's Canada's 15th case since September, is prompting officials here to remind people that vaping can carry major health risks. Aaron Collins has more.
Not much is being said about Alberta's first case of severe vaping illness, but the province's chief medical officer says the patient's condition was serious.
So this particular case is someone who is an adult, started to feel some symptoms early in December, some shortness of breath and coughing, and symptoms progressed. They did require treatment in hospital, but have since been discharged and they're recovering at home.
Despite the fact that the patient is recovering, Hinshaw says vaping is a risky activity.
A message that vaping has health risks, some short-term, some long-term, and reminding people that if they're choosing to vape, they're choosing to expose themselves to those risks.
More than 50 deaths in the U.S. have been linked to vaping so far. Vaping hasn't been connected to any deaths in Canada. This fall, the federal government asked the provinces to report suspected cases of severe vaping illness. Of the 14 previous Canadian cases, some patients used vapes with nicotine, some had THC, and some had used both. Vapes aren't for sale at this Calgary cannabis shop yet. The Alberta government has delayed the release of cannabis vapes in the province until at least March, citing health concerns. Quebec and Newfoundland have already banned the sale of THC vapes, but the owner of this shop says some vapes are safer than others.
Because there's good vapes and bad vapes. We just need to figure out what the good vapes are and what the bad vapes are, and then put policies in place to ensure that we only use the good ones.
Alberta is currently reviewing its laws governing tobacco and vaping. A final report is expected in the coming weeks. Aaron Collins, CBC News, Calgary.